Okay,
Oh,
so hello everyone. We are CareIQ, a mobile app that helps patients understand the severity of symptoms in order for them to make smarter healthcare decisions and prepare better for doctor's visits. So here's the background of the project, in which we will go through the following ideas from discovery, problem formation, ideation, and design.
so that our challenge is to design AI health assistant that puts human needs at the center, redefining how patients interact with AI to get the care they need. So the question we were asking as we design is how do we build AI experience that user can understand, trust, and rely on? What's the problem? Patients lack medical knowledge and vocabulary to understand their symptom, assess their severity, and find the right professional. This leaves them anxious, hesitant, and unable to use a virtual AI assistant tool effectively. So what we are doing is AI assistant that is trustworthy and easy to understand could help bridge this gap. Who is affected, a patient of all background, their families, and the healthcare system and the healthcare professional. Why this matter is patients seek better health tool to live longer, healthier life, to make smart decision and more affordable healthcare decisions, to feel confident and safe in understanding their diagnosis and care. So we believe that patients deserve accurate diagnosis. So the target users are primary are the patients, and secondary users are family, caregiver, senior citizen, and influenced users are healthcare professional and hospital services. So what we measure our success metrics is improving the patient healthcare experience through better information, trust, and engagement. So AI assistant tool that empower user with clarity, trust, and actionable guidance through their care journey. So now Shinak will give us the research analysis and interview findings.
Yeah, so okay, I'll be talking about the primary and secondary research that we did in order to really understand the problem space happening within healthcare. So we did secondary research to get up-to-date information on the types of challenges people face when navigating the healthcare industry. And from a January 2026 article on castlecolony.com, about 44% of people say that communication style, medical credentials, training, and office location is very important. About 64% say that healthcare system is complicated. 1 in 4 people say that they have a great deal in trusting doctors, but half say that they avoid medical care the past year due to difficulty finding the right doctor. And 2 out of 3 people say that they search for a doctor takes 12 months, which is longer than average. And this shows how difficult it is to find and get the right type of help they need. So we looked into popular medical apps and healthcare companies that focus on solving the problem space we were solving for. And we looked into each app's features, navigation, information architecture, each problem they solve, and weaknesses that they have to take that as an opportunity to improve. Now, we did create the following prompt to speed up our research flow, which was, as a UX designer, our goal is to learn how people manage their health and to understand patient challenges in communicating symptoms and receiving better care. And we're also exploring your thoughts on AI to understand symptoms. And our target audience is consumers that are high risk, pa regular patients, and senior citizens. And we also inputted our success metrics. So in terms of what these products do great, they do a great job in promoting healthcare education so that users can be empowered and manage their own health, and they are very trusted brands within the healthcare industry. Second, tools like AI can generate quick summaries to simplify patient information, to streamline workflow communication between doctors and patients, and personalized recommendations based on history. Now, in terms of areas to improve, there is still limited trust within AI, and people want to understand why AI generates certain recommendations with clear reasoning. Second, some of the tools like empathetic language and feel robotic. And then third, the information when doing certain tasks can take longer than expected, which can cause user fatigue. So we got our surveys out to understand the following challenges and seriousness happening within treating symptoms and getting the best possible help when managing health. And from 26 participants, about 69% say that they're unsure when to seek medical care. 80% are not sure what type of specialist to go to based on their needs. About 65% said that they have under or overestimated an issue, and 53% say that English is not their native language. So after that, we conducted 4 interviews to understand the challenges people face with navigating the healthcare and their thoughts on AI. And we still utilize the same prompt from the competitive analysis to generate the following themes from the raw data from the surveys and interviews, which was that users trust AI but prefer AI as an assistant. Users struggle being able to communicate properly. And then third, users struggle navigating healthcare. So in the same prompt, we generated the following insights and collaborated through team feedback, which was that AI should be an assistant but never replace doctors, as people rely on AI for speed and organization and would use it for guidance than a final decision maker. Second, patients have a hard time understanding medical terminology, as well as language barriers can result in harder communication, especially for those whose English is not their primary language. Third is the type of insurance people go to affect which type of doctor they could go to based on their budget and location. And they also face challenges finding specialists. And then finally, users want to make sure that they get sources from trusted, reliable hospitals and medical and people within the medical field. So here we have our 2 target personas. So Sarah Jenkins is someone who uses a wait and see approach for non-urgent symptoms, and she constantly weighs between financial decisions and commute. And while she trusts doctors, she also suffers from articulation anxiety, and she fears she won't be able to communicate properly, which could cause her healthcare issues to be dismissed. And she's always exhausted by searching online, and so she uses AI to speed up and get information quick. Over here, we have Bethel, who's a caregiver who cares a lot about making sure that her family is covered by insurance, and she trusts long-term doctors. However, she's unfamiliar with AI and does not trust it much. She values human interaction. Now, as a team, we generated tons of problem statements and utilized different AI platforms while implementing team feedback to create a framed problem statement, which was that users struggle to determine if a symptom is serious and if professional care is mandatory, which causes them stress and possible risk, which can be ignored. In addition, they cannot explore their symptoms properly due to limited medical knowledge, which could cause their healthcare issues to be dismissed by a doctor. So I'll now pass it on to Julie, who will talk about the ideation and designs.
So as we built out and explored the concepts, we detailed the pipelines and systems to handle custom patient-doctor interactions. And what we focused the most is on building an empathetic system. So here's an overview on how we conducted that. So on the left here is our initial conceptual maps. You know, they're linear, pretty rigid, and had critical blind spots. And so starting from here, we move down here and then onto the right are our final screens and wireframes. We've translated those system logic blocks into more concrete, empathetic user journey. And as you can see in the highlighted interface callouts, we broke down complex health questions into a smooth onboarding process, and like symptom mapping and clinical outputs designed to solve real user frictions. So one of the biggest pain points we found during the surveys and interviews is the communication gap inside the examination room. And because appointments are brief and patients are under a lot of stress and they're really like ill. So they often forget symptom timelines, like when and what happened and get overwhelmed by the complex medical terminology that they're not familiar with, and which um, they may not be familiar due to not being familiar with the language itself as well. So it'll lead to miscommunication and like patients feeling unheard. So to bridge this gap, our app acts as a dual-sided translation layer through our preparing for visit workflow. So for the patient, it provides a visit prep checklist. Um, and it's tailored with speaking points so they can confidently advocate for themselves. And we have an on-demand like medical jargon decipher, which tapping any clinical terms can reveal plain English definition. And here you can also see that there is an AI generated questions list, which the app will suggest the patients what kind of questions they may already have that they could just click and find out answers to. Or if they don't see any related questions, they can also look into the interactive chatbot and ask any further questions. Oh, sorry, further questions that they have. And the last screen here is a patient and both provider facing doctor mode screen. So, oh, sorry. So this screen translates the patient's plain language into a structured points that are listed here so that um, the patient can really take this into their appointment with the doctor and like lay out everything clearly with the symptoms they have, and also have some questions prepared to remember to ask these questions at the appointment. And part of this screen, I'm showing this edge case we designed. Even after the AI generates any customized talking points like these, a user might still find the vocabulary overwhelming. And to solve for this sort of edge case, we added a simplify terms secondary button, which can act as an fallback, allowing users to like instantly rephrase and remove any complexity and to simplify into an easy to understand plain English that is much easier for them to um, understand. So this ecosystem is really intended to protect patients from like clinical isolation. On this slide, you can see how we translated our conceptual user flows into concrete interactive features. So first is an interactive body map. To address any struggles with limited medical vocabulary, we implemented this interactive body map. So if a user can't find words to describe what's wrong, they can visually pinpoint where they are feeling the pain. And second, this screen is the contextual image upload. And because AI would require high integrity data for even more accurate assessments, we designed this contextual image upload feature where the user can upload images. And if the app determines if that the images are blurry and not clear enough, it will automatically boost the resolution and protecting the user from any invalid assessment. And the final screen here to the right is a symptom slider system, which will replace any open-ended forms with these intuitive sliders and chip selections. They'll allow users to really capture the pain levels and the duration and their emotional states without any friction. So moving on to show the designs. This is a quick look at how we leveraged AI to build our visuals. And a huge help for me personally was a prompting framework that Rodrigo shared in one of our workshops. I took his baseline formula and layered our specific healthcare constraints and also anchoring to the Google Material 3 design system that's already in place. So all the design structures remained architecturally sound and accessible on top of what we're trying to implement here. And we also, so here are some screen iterations that we did we all were in charge of like trying to use different AI tools and different combinations of AI tools. And these are some of the refined screens on the right. And yeah, and of course, using these tools cut our design time in half and really got us from basic ideas to final mockups really incredibly fast. And so this is our like visual identity we engineered as well. So for color, we chose a grounding, high contrast, like sage and cream to provide a stable, trustworthy foundation and few accent colors for emphasis. And for typography, we prioritize the scannability and like high visual hierarchy to ensure that like a both stressed patient and like a busy doctor can digest information instantly. So just to wrap up, you know, there are two main points that I wanted to um, close this presentation with. And first is that dual-sided UX really requires equal empathy. We learned that solving healthcare communication really means designing for both sides of who are in the exam room. So it wasn't just enough to give like patient tools, but we had to like balance with what the doctor may need. And secondly, AI is an accelerator, not a replacer. So traditional UI rules can change when, for example, like a user is emotionally heightened, especially for app like ours. So even like well-designed AI summaries can cause like cognitive overload in like such a tense waiting room that the patients are suffering. So yeah, so these are a summary of our learnings, and thank you so much for listening.
Cool. Yeah, nice. Thank you for sharing this. Um, Great work, actually. So can I ask a couple of questions? So what is the AI stack behind this application?
AI stack, oh, what did we use?
Yeah, like okay, two parts probably. Like what did you guys use for the presentation? I mean, for the whole case study and the 6 weeks of work. And just to probe or some to just to poke, like what AI did you guys have in mind? Like if you are going to build this, like, hey, these are the AI tools which would power this app, right? So I'm just curious about that.
Oh, so I mean, we would probably we have a bunch of screens put into like wireframes and we would take this to I mean, we have it mostly built on Claude and Google Stitch, but we'll connect that with the VS Code and send it to GitHub and connect it to I forget what it's called. Um not glitch, but not Replit, but there's a tool you can connect to publish it and refine anytime as you're making changes on the AI tool. So that's probably where we would take this next.
Cool. Yeah. And uh I mean, I'm surprised you guys thought about boosting the images, right? So have you guys did some research on what AI tools can you actually use to boost those images? And part two of that question is, have you checked the laws and the legal procedures for users to actually upload images which can be boosted or not?
I'm not quite sure with the first part of your question.
So, I mean, yeah, again,
As
this
in
is just, yeah. So I want to, so as per like HIPAA laws or like legal laws across Canada and USA, we cannot upload like let's just say an X-ray or any user health photographs, which can be processed in general AI tools. Like there are certain AI tools which are like approved by these medical, like organizations, which can be used to because since it's medical data, they need to be approved by these medical councils, which can enhance certain pixels, right? So that's why I was just wondering again.
Mm.
Again, the idea is like really good, I was just
Well,
wondering
yeah.
whether, yeah, whether you guys did some research on that. That's all. Because it's actually a great idea, which lots of apps do use. So
Uh-huh.
yeah, so I was just wondering whether you guys did some research already and found out which AI tools would allow you to do it. That's all. So
Because this is to, I guess, take a photo of something that you're seeing on your body. So
okay.
I would rather think that this would have more like privacy regarding like the camera side and um I don't know if it would be actually really related to like uploading x-rays. Like it would be like blisters or, like those anything that you see on your body at the moment. So that's what we were thinking with the camera functionality.
No, I mean, yeah. I mean, again, just to reinstate, like the idea was good. There's nothing wrong. It's just next time if you guys are presenting this case study somewhere, that's something to keep in your mind, so that if somebody asks you the same question, you have, the right answer. Yes, we did some research. Like this is what we're going to use. So, yeah, just a suggestion there. Um, then if we go back to the designs, like one of the things that most of the AI tools when it comes to like medical diagnosis, what they struggle is a semantic amplification, which is basically like, like you ask a question to these like patients. It's basically placebo effect, right? You ask a question like, hey, is the pain is throbbing, or is it prickly, or is it like, like tingling? And they suddenly start feeling that, and they would like answer, like, yes, it is hurting me more. So have we thought about how do we solve that problem to prevent that semantic, like amplifications? Have you considered any methods in terms of, like those questioning frameworks, or how do we collect information so that users are not giving placebo symptoms as answers in these apps?
Yeah, would anyone else like to take the chance to respond?
Yeah, so can you just elaborate more on your question regarding the designs?
So my question was again, how do we prevent this app from doing a semantic amplification? Like as I said, like leading questions in some of the medical apps when they are trying to collect information from these users about the symptoms that they're currently going through, right? Like for example, when I ask a question like, "Hey, is the pain sharp or throbbing or tingling?" Even though the pain might be like, like very, very low, the moment you ask a question about the pain, you give them a scale, they would feel like it's a 10 or it's an 8, even though it might be a 2. So my question is like, how do we prevent those kind of placebo symptoms? Have you thought about the questioning framework or collecting information which would help, patients to give accurate answers?
Yeah, I mean, like the closest that we did so far when we were designing our solutions is like once like the user inputs as much information as possible regarding the issues that they're facing, there is a page where it showcases the types of possible issues that the user is going through, and it's all like in a prioritized order. And at the bottom, it's like there's like a disclaimer page where the AI is basically letting the users know that this is like a possibility, is not a complete diagnosis of your issue. So you can always like get in touch with your doctor over the phone. That's number one. And number two, though, there is an option where the users could also like find like people schedule a telehealth visit to make sure that they're like um, spending their time wisely to make sure that they're like diagnosing the issue smartly. So
Okay, cool. Yeah. Okay. Um, Um, and in the designs, I also like noticed the app was helping them to prepare for the doctor's visit. If that is the case, like, did you guys think about, because it allowed you to search doctors and also prepare for the doctor visit? That means, are we connecting this app with the doctors? So do our doctors have like their own version of this app, or
yeah,
this is
so we were thinking about like creating like some type of design feature where users schedule a doctor's visit. But for the sake of time, we made a decision to put that out of scope. We just wanted to focus on the main like functionalities, which include like making sure that the user is able to like that find a doctor based on their personal preferences, like working with their current insurance plan, along with their language preferences, how close they want to be. So
Okay.
And then also, actually, we as a team, we discuss about it because one of our persona is more would like to have a human connection, a doctor. So we have discussed about it, but since we have very limited timing, we stayed only for not to put that information more.
Mm.
Yeah.
Okay. Cool. Talking about personas, like how did you narrow these two personas as your primary target personas? Because I would say it's not just the patients sometimes who are facing or trying to diagnose things, because you have a lot of like primary, physicians or like medical students or like residents or even like like triage nurses who might be like handling patients. And sometimes doctors don't have all the answers. Nowadays, doctors are actually using ChatGPT or Google or YouTube to get a lot of their information quickly as well. So I'm wondering, like, did we think about other personas, and why did we like choose these as the primary personas for this exercise?
Well, those would be very interesting use cases. Um, I guess, ours really were based on the interviews we conducted, based on the like survey. So like among the surveys, we asked, those who will be able to participate. So we did do about, how many was it? Like 26 surveys, but if we had a broader pool, we may have been able to like expand our persona a little more. But
Okay.
yeah, I think those would be very interesting use cases to think about.
Yeah, sure, sure. Yeah. And did did we go through a comp analysis? Like, did you guys check out other apps which are trying to do the same thing?
yeah, so we did do a competitive analysis on like popular like AI platforms and stuff like that. The issue that we were seeing like with a lot of these like competitors is that sometimes like the language that these apps use could be very generic. They do most of the time they might not have personalization or personalized suggestions, especially if they don't have like AI implemented into them. In addition to that, though, some of the like when looking into like let's say like popular, not popular, but like common issues or diseases, the jargon is still there, and so our goal was to making sure that we focused on building something that makes it feel more human as possible, as well as making sure that we're simplifying everything from beginning to end to the user in terms of like entering their like information and stuff like that. So
Which apps are these that you looked into?
it was Mayo Clinic along with Amazon Health. In addition to that, it was K Health, A Bridge, and UB.
Okay, cool. Um, and did uh, uh, did we look into the overall primary and the secondary research methodology? I know you spoke about it, but I'm not sure whether did I see like how many users did we have in the survey? Like which country or which area did we cover?
So overall, we did interviewed for mainly for our primary research. We got 26 surveys, 26 participants in the surveys, at least four
Okay,
to five interviews,
okay,
and our demographics were mostly people in the United States.
okay, cool, awesome. I think those are the questions I had. Thank you. It was a great presentation. Yeah.
Thank you so much for the great questions.
Yeah.
Thank you.
That's great. Like really, very good presentation and follow up, really, very good questions as well from Halik that will help them to enhance the work that they have already done. So that's great. Congratulations, team. Good job.
Congratulations. I'm proud of you.